The way mental health is discussed online can often be dangerous. And I don't see a lot of people making videos on this specific topic. Not too long ago, I saw a video whereby an influencer who specifically makes content for young men was discussing mental health and was essentially dismissing it. And he was giving kind of generic advice. And the reason why I find that dangerous is because, so this year I had a psychiatric placement. And during that time period, I was with a lot of specialist doctors, consultant psychiatrists, and the way that they would discuss mental health wasn't this mystical thing where the only thing that you need to change is your mindset and all you need to do is just exercise. And even though advice like that could work for a lot of people, you can't just give that as a blanket advice. And the thing that I noticed with the consultant psychiatrists was when they would discuss a mental health condition, like let's say depression or anxiety, they wouldn't speak in like generic terms. They'd discuss specific diagnostic criteria, and they'd mention the specific features that a patient would have. And then they would discuss the specific management that was suitable for that patient. So relating that to what people often mention online, the reason I believe is dangerous is because let's say there's 1 million people that watch that video, and because of the way that it's discussed, it's kind of stigmatized. And say amongst that 1 million people, there's 1,000 young men who, out of them, 999 hear it and they find it beneficial and they start exercising and they change their mindset. But let's say one of them, he doesn't just have low mood, but he actually has depression. He's got clinical depression. If he hears that advice and he refuses now to seek help, that could be the difference between if he continues to stay alive or not. When the psychiatrist I was around would be discussing patients, a key thing that was always factored in was risk. What's the risk of the patient harming themselves or harming other people or harm from other people? And when you give generic advice, you can't factor in those things. Let's say that young man who actually is clinically depressed watches that video and now refuses to seek help. And let's say during that time period, he loses a friend or his pet or one of the reasons why he wants to continue on in his life. That could be it. That could be the breaking point for him. So I think when people discuss mental health online, they should be careful in how they describe it. It should be no different than any other medical condition. So I think this is something that needs to be spoken about more.